So this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County, and we are going to talk tonight about COVID, as we have now for about 16 months. Well, tonight is a somewhat special event because this is the most ominous day that we've had now in almost a year. So starting at the world level, we'll move down then to the local level, but this is a chance to get your questions answered. So if you have questions, please put them in the chat section. In addition, we have already had about a dozen people send us questions. So somebody says they're looking at my nose here. So we'll get to those questions first, and then later on we'll go ahead and get to the questions that are in the chat section. So in the world, it's truly ominous. We're seeing a real increase in the number of cases. This increase is in all continents. So in the past, we didn't have very many cases in Asia, and North America was coming down. However, right now what we're seeing is an increase in North America, especially in the US. South America remains a mess, and we're starting to see more cases in the Caribbean. Africa continues to have an increasing number of cases, and that's very worrisome because Africa has had almost no vaccinations. They've had very few previous cases, so there's almost no natural immunity there. And that is an absolute right place for new variants to come up. Asia is starting to see more cases, especially in Thailand and Myanmar. Also Malaysia and Indonesia are areas that are seeing increasing disease. Malaysia and Indonesia are worrisome because this is where almost all of the gloves in the world come from. It's weird that 80% of our gloves come from Malaysia, but if Malaysia now is badly hit by COVID and they need to shut down industries, that's going to put a further crimp in our delivery of gloves, which we're already a bit short. We're also starting to see an increased number of cases in Europe. So it started off in the UK, had a lot of cases. Now we're seeing more cases in Spain, in Portugal, and some of the countries in East Europe. So that's a worrisome. And in the U.S., we're seeing a definite sharp increase all over the country. I checked all 50 states, and all of the 50 states have an increasing trend. That's very worrisome. But it's really terrible in Missouri, Arkansas, Louisiana, Alabama, parts of Georgia, and northern Florida. It just is amazing how many cases they're having in those areas, thought to be almost all due to the fact that they have both the Delta variant and they have a low rate of protective measures. They're not doing much public health measures such as masking and distancing, and they have relatively low rates of vaccine. So keep that in mind. Those areas now really hot for the past 5 weeks because of a decrease in public health measures, low rates of vaccination, and the Delta variant. Oregon is seeing an incredibly sharp rise. So we increased the number of people in the hospital today with COVID by 50 in one day. 50 in a single day in Oregon. That's the steepest rise we've seen. They reported over 1,000 cases today. And these are in Josephine, Jackson, Lane, Umatilla, and I think you'll hear sadly in Douglas County. So you remember 2 weeks ago, Douglas County was going down with days in the single digits. However, in the last 3 weeks, we've had 2 known introductions of the Delta variant, one from Arkansas and one from Alaska, and 3 suspected introductions of the Delta variant. And when the Delta variant hit, it just totally spiked up. Vanessa reports that we've had 89 cases since noon yesterday. The OHA reported 60 some odd cases today. That is far and away our highest. And during the whole time, our highest numbers were in the low 40s. And our numbers today look like they're going to be over 60 or even more. So really, truly an increase. And this increase we're seeing in Douglas County is widespread. So you remember in February when we had a lot of cases, there was a nursing home that had a lot of cases that got reported in one day. That's not what we're seeing here. What we're seeing is that this is in mostly young people, so mostly people in their 20s and 30s, all throughout the county. So there's no place in the county which has been spared. And what we're seeing them in is groups that are moderate-sized groups of 5 to 10. So workplaces, social gatherings, churches that have now one person gets sick, and the next thing you know, 5 or 10 people in that group are sick. In addition, because the Delta is here, it's not shocking that we're having more breakthrough cases. So a breakthrough case is somebody who's been fully vaccinated and then gets sick. And we'll go through a lot more in breakthrough cases because that's an important thing. That's an important thing to pay attention to. But let me get to the questions, and then we'll go through the rest. So Gordon says, will DPHN recommend a temporary county-wide mask mandate soon in light of the Delta cases surging? So when we talk about masks, there are mask recommendations, and then there are mask mandates. So mask mandates are political or legal things that you do, that you mandate that people wear masks, and there are consequences if people don't. So for example, in the last year, we had mask mandates, and the mask mandates were related to businesses, and in those businesses, if they did not require that people wore masks, OSHA would come in and set fines or whatever. If bars did not do it, then the OLCC was enforcing that. So I do not think we're going to get to so certainly the county has no way to enforce a mask mandate. However, the question is, will we recommend masks? And I think with this high level of disease, I would certainly recommend that people wear masks when they're in an indoor situation. And they should probably try to avoid indoor situations as best they can. And it's certainly not unreasonable to wear a mask, though there's a little bit of change in tone from the CDC that came out this afternoon. Previously, the CDC said that if you were vaccinated, you did not need to wear a mask indoors, but should if you were not vaccinated. Now what they're saying is you should wear a mask if you're indoors if you're vaccinated and in an area with rapidly spreading Delta. And I think Douglas County and pretty much all of Oregon at this point would be considered an area with rapidly spreading Delta. So I really get worried. This next question came from a bunch of people, and it is really worrisome because it suggests that people don't know what's going on. So it says, why should I get vaccinated if the risk is the same of getting the variants if I'm vaccinated or not? The answer is that is totally not true. So let me give you the numbers here. In the last 2 weeks, we've had 224 cases. 205 of the 224 were not fully vaccinated, and 19 were fully vaccinated. So the vaccine was 85% protective in not getting a case of the disease. So 85%, that's about what we're expecting with the Delta. It was 95% effective in preventing hospitalizations. There are 22 people in the hospital now. Only one was vaccinated. So again, the premise of if the risk is the same of getting the variant of vaccinated or not is totally not true. Your risk of getting the variant is much less if you are vaccinated. And that says, and the potential death from the vaccine is high. The potential death from the vaccine is very, very, very low. So the number of cases, the number of deaths in the United States that have been specifically linked to the vaccine are less than 10, and those are from people who have the clotting issue related to the J&J vaccine. Now, there are some unscrupulous people who will say that VAERS reports that 6,000 people have died after getting the COVID vaccine. That is not surprising. There's a system, a very careful system called the Vaccine Adverse Event Reporting System, or VAERS. And if somebody within 6 weeks after getting a vaccine has any side effect, you're supposed to put it in there. So obviously you have a patient and your patient dies 5 weeks later, you put it in there, and it may be related to the vaccine or maybe not, but we carefully look at those. And except for those that were related to the J&J vaccine and the clotting issue, none have been thought to be caused by the vaccine. Now, in Douglas County, we've had 2 people who have died within a few weeks after receiving the vaccine. We've looked at both of those cases. Actually, the state medical examiner looked at those cases, and it was felt that their deaths were very clearly not due to COVID, but due to the other things that happen. So again, almost all the cases we're seeing unvaccinated, the risk of getting the variants is much lower if you're vaccinated, and the potential of death from the vaccine is low. And really, the people who are spreading this really need to look at their morals about what they're doing. There's a story in the New York Times this weekend about a fellow who is doing a lot of this, and he's making millions of dollars by spreading this misinformation. So the next question is, what percentage of the new cases are unvaccinated? About 85. How many deaths have we seen from the vaccine locally? None. Again, remember, there are 2 deaths that were reported after the vaccine, but both of those were reviewed and were thought due to other underlying conditions. So please talk about booster shots again. Do you think the process will be similar to the first vaccine? How soon do we expect to have the boosters available? Allison asks. Well, I think the idea on the boosters, you get the same shots that we have there now. So I think the boosters are currently available. I don't think we're going to have to wait for that. I think what we're waiting for is guidance about whether you need boosters. Right now, we've not had any guidance about whether you need a booster and who would need a booster. Certainly wouldn't be shocking that people with poor immune systems might need a booster. So, for example, a study came out this last week that looked at people who had solid organ transplants, mostly kidney transplants, and they were found not to make very good response to 2 doses of the vaccine, but did make a better response after the 3rd dose. So it wouldn't be shocking for the FDA to recommend that people who've had a solid organ transplant get a 3rd dose of the vaccine. And there may be other people too, people with weakened immune systems because they're on immunosuppressants. Maybe older people might get a booster right now. So the boosters are there, but there's no recommendation yet to go ahead and give them. So Christine says, what if my 13-year-old child already had COVID and we don't know it? Is she safe to get the Pfizer vaccine? Yes. They were thinking of doing tonight the half shell. That would be great. That's a great lead-in. Our Tiger team is going to be at the half shell tonight giving vaccines. So if you want to go ahead and get a vaccine, please do it. We had a little uptick in our newly people vaccinated last week, but still is very, very low. Christine also says, will the schools go back to the same metrics as last year? I don't know actually what's going to happen at the schools, and we're not sure. What is currently being published is that the health and safety recommendations for the schools will be left to the local elected school boards. So the local elective school boards can choose which health measures they want to use and not. Now, there's strong recommendations. There are strong recommendations that the kids wear masks. There's strong recommendations that if schools have multiple cases in the school, they consider the possibility of closing school for a while or closing classrooms for a while until we get there. But in terms of countywide metrics, I do not think we're going to be there. So Michelle says, are the local hospitalizations there because of COVID, or are they there for other reasons? So again, this is another one of those falsehoods that gets there. So we look at the hospitalizations very carefully. Right now, everybody who's in the hospital is there. There's 22 in the hospitals this afternoon. They're all there because they have COVID. They're not there for other reasons. Now, we've had several hundred hospitalizations over the time of this pandemic. Not surprising. Sometimes people were in the hospital and had COVID, but they were not in the hospital because they had COVID. So, for example, you could imagine you're pregnant, ready to deliver. You go into the hospital, they test you for COVID, you're positive. You're not really in the hospital because you have COVID. You're in the hospital because you're having a baby and you happen to have COVID. And so we've had a handful of those cases, mostly around pregnant moms, but we've had a couple of traumas where one guy broke his leg, and when he got into the hospital and they were going to go ahead and do his surgery, they checked him for COVID and he was positive for COVID. But that's just a handful of the several hundred cases we have. Similarly, there was a nasty comment last week that suggested that almost all the people who were in the hospital or were dying weren't really dying of COVID, they were dying of drug overdoses or other things. That really is so insulting to those poor people who are in the hospital. When we look at our deaths, again, almost all of our deaths are related to the underlying COVID diagnosis. Now, we did have one person who had an out-of-hospital cardiac arrest and was brought into the hospital, was found to have COVID. We did not think that the cardiac arrest was related to COVID, and thus the state reported that as a death, but we did not. Similarly, there was a nursing home outbreak in the spring. There were a number of people who were positive. There was one person who died a bit later after that, and it was really hard to know whether they were old and were going to die anyway, or they did it. But overwhelmingly, so of the over 80 deaths we have, almost all of those are related to the underlying diagnosis of COVID, and because they have it there. These are not people who are like end-stage COPDers who just happen to get COVID and go in the hospital. When I look at the people in the hospital, these are young people. We have 2 people in their 20s who are there. These are young, otherwise healthy people who are hospitalized because they have COVID and they have that. And we really need to get past that. So the people who wrote these things to me, really, if you have any true evidence to the contrary, please send it. We'll be happy to look at it. Another question is, what can you tell us about the recall of the PCR tests that were deemed faulty? So there's a kind called Quidel-Lyra tests, Quidel. And basically what happened is there was a computer glitch, and cases that had a very high viral load sometimes got reported as negative. Not that there was anything specifically wrong with the test, but clearly the report was wrong, right? Because it would report when it was negative when it was truly positive. And so that really is a mistake. So these tests were developed. They were developed quickly, and it's not shocking that there were some errors. What this likely did was undercount some cases. So false negatives means that you had the disease, they reported as a false negative result, and so it probably, if anything, undercounted cases. You really don't want to undercount cases or miss cases, right? Because this person comes in with COVID-like symptoms, you would get a false negative test, you then may not do isolation in the hospital, you might send them back to their family, and then it would cause more spread. So this was really a problem, but I think they fixed it. We do not think they were using lots of these tests in Douglas County. So this is a long question. So it seems from what I've read and heard that vaccinated individuals are becoming infected with COVID. It seems the Delta variant. While their symptoms are less severe and they're not experiencing hospitalization, I'm curious about the following. So do vaccinated people have any long-term symptoms from having COVID? And do those vaccinated with the Delta variant, those vaccinated who come up with the Delta variant, transmit the virus at the same rate as the unvaccinated? So let me go on that. Well, we don't know about long-term consequences of the Delta because it's just been out for 2 months, so we can't really know. We know in the past when people got infected with one of the other variants, they had a not dissimilar story from the variant. So long COVID is one of the big worries, and I don't think we know enough to know if it's worse with the Alpha, the Beta, the Gamma, or the Delta. So do those vaccinated with the Delta variant transmit the virus at the same rate as those unvaccinated? We don't know for sure. There was a study that came out today that suggested that they transmitted at about 1/5 of the rate of people who were unvaccinated. So that's another reason to get it. So this week we actually had quite a few breakthrough cases in one office. So there was one office where almost everybody was vaccinated. Somebody came in and about something like 10 of the 30 people in the office had symptoms, were found to have that. We think that's almost certainly going to be a Delta case. Those people were not seriously ill. None were hospitalized. And again, the vaccines are the very best at preventing hospitalizations and death. I think all the studies suggest that they're at least 90% effective for preventing hospitalizations and deaths, and that's what we've seen. And good, but not nearly perfect at preventing mildly symptomatic infections. So that's how it works. So once you've been vaccinated and have also had COVID post-vaccine, does this boost your antibody? Yes. And lastly, is the state considering requiring masks again for all, or is this going to be a county decision? And again, I started at the beginning by saying a recommendation for masks, and I would truly recommend that people, especially if you're unvaccinated and you're going to be in an indoor setting, to wear a mask. A requirement means that you're going to require businesses or others to do this and have consequences for people not. And at the county level, I mean, how could we enforce this? We're not going to send the sheriff in to go ahead and do it. Early on, the state did this through OSHA or OLCC, and we don't have a OSHA or OLCC. So Bruce says, it'd be great if you can explain what an infection is. As I understand the biology, vaccines only come into effect once an infection has occurred. Then the immune system acts to remove the infection. So when we say a vaccine is effective against infection, what are we really saying? So it's a little bit more complicated than that. So sometimes when you get vaccinated, you're vaccinated against something and you have such a high level of antibodies that the germ never gets started, in which case you can't really say you were infected. But in many cases, the way that vaccines work is they give you a level of antibodies. Those level of antibodies start to, when the germ gets into the system, starts now to attack that, and you may get a very mild infection, but because it's a very mild infection, your body kills it off. There was a story in NPR this weekend about exactly that. We know that with certain vaccines, like with the measles vaccine, what we recognized was that early on, early on, when there was still some measles circulating, if people get the measles vaccine, they would build up antibodies. Sometime later on, somebody around them would have the measles. They would get a very low-grade infection with the measles, which would boost their immunity again, and that's how they would fight it, so they would never get sick. We think that's what's happening maybe here with some of the vaccinated people. So you're vaccinated, and you get exposed to the germ. Your body is able to fight it off, in which case it's that second. So it's sometimes the first and the second. So I'll read the question again. So vaccines only come into effect once an infection has occurred, and we think with COVID that's probably the case, but with other vaccines it works differently. So we can start traveling together. We can start traveling to Canada starting on August the 9th. We need to be fully vaccinated, have a negative PCR test 72 hours prior. Can you have a positive PCR test even if you are fully vaccinated? Yes. If so, as a precaution, what safeguards should you do prior to testing? Let's say you're really wanting to go, you're putting some money into doing this. What you might do is to do a PCR test about 10 days before you travel. If that is negative, then the chances are that you will still be negative 10 days later. The problem we've seen is that some people are positive, say in February, and they may still test positive on the PCR test for weeks or months later. Most people don't. Most people test negative after about a month. But we have had some people who've tested positive for a month after month after month, in which case, by the current rules for travel, they would not be allowed to travel. So you might get a test 10 days before. And if that's negative and you're otherwise well in that time, then chances are very good that you'll be negative 10 days later. So in my 3-month check-in with VSafe, why am I being asked if I've had positive pregnancy test since my vaccination? I do not know. The VSafe program is a program that after people get vaccinated, there are people who are parts of studies to see what kind of side effects they're having from the vaccine, whether they've gotten sick or not. I do not know why they're asking about the fertility. I can tell you the fertility stuff is another one of these very false rumors. I mean, it got started by somebody who had no basis for it, but unfortunately, fertility is one of the things that young people, especially young women, care much, much, much about. And so this worry about fertility is really worrisome. There is no data that it affects fertility at all. So Tiffany says, how likely is it to contact COVID after recovering from it? So the question is, what is my protection from a natural infection? So the protection from a natural infection is quite good, overall about 80%. However, if you're immunosuppressed or So if you're immunosuppressed or over the age of 65, it's only about 50% protective. So less likely than if you've never had it before, but not nearly as good as the vaccine. So Daisy said, are PT, if you're meaning physical therapy clinics, still supposed to be enforcing mask wearing? I don't. So PT clinics are medical clinics, and medical clinics are supposed to be continuing to wear masks. So if you go into a medical clinic, they should be wearing masks. I know there are some clinics around that are not doing that, but I certainly think now with the high rate, we should be doing it. So Angelica says, besides asking and hoping people take COVID seriously, what is being done to protect people? Are there policy changes happening because of the surge? I know there's a lot of discussion. I'm not sure that there are any. So Angelica, if you have suggestions about what we might do, that would be great. So, I mean, you could close businesses. We know that closing businesses work during the early stages. We could have mask mandates. We thought mask mandates worked. But again, reporting from a level, unless we're going to go back to where we were before, I think it's going to be very, very, very problematic. So Rebecca says, I've lost respect for the medical community. Why don't we recognize natural immunity? So Rebecca, we clearly recognize natural immunity. We just talked about it. So we just talked about the natural immunity. That natural immunity provides some reasonable immunity, about 80% overall, about 50% for people who are 65 and above. We could, so one of the strategies, and this was a strategy early on in other places, was to just let everybody get the disease. Let's just have everybody get it and see what happens. Well, if we just let everybody get it, we'd be sort of in a situation like we are today, but we would be like that for 3 years. And hospitals are running out of right, because we had, say, 60 cases today or so. There's 112,000 people in the county. Be 1,600 days until everybody got it. And so that's a really long time of dealing with this level of disease. So, Rebecca, if you have a better strategy, please let us know. So Karen says, how protected are you with the Pfizer first shot? So it seems, especially with the Delta variant, that the second vaccine is really quite important. So there have been reports that the first single dose of the Pfizer Moderna is probably only 30 or 40% effective, and then moves up with the second dose. And that's why it's important to go ahead and get that second dose. So if you get your first shot, can you wait 4 weeks for the next? Well, the time in between the doses is not because we're rationing the doses. It's because the way the vaccine works is the first dose gets your T cells and B cells primed for the booster dose. And then once they're primed for the booster dose, they make a better response. So if you just gave, say, the first dose and then the second dose an hour later, it's not nearly as effective as waiting a time. Actually, they came up today they came up this week with a report from the UK that the optimal time for making antibodies is 8 weeks. That's not surprising, because if you remember all those shots that we give to babies, typically about 8 weeks apart, because 8 weeks is long enough for the T cells and the B cells to do it, but short enough that you haven't lost any antibody response. The problem of waiting 8 weeks is then you have an additional 4 or 5 weeks where you're not getting the protection of the second shot. So that's why we went with the Pfizer 3 weeks and the Moderna at 4 weeks. So Joe says, I know a plethora of people in the past week diagnosed, and every single one was fully vaccinated. So Joe, you must know a really subgroup of people, because remember, there were 244 cases, and only 19 of the 224 were there. Now, there's one workplace in town where there were a lot of vaccinated people who were sick. So if you know everybody in that group, then you may know a lot. But again, they didn't get particularly sick with that. So again, Joe, give us the names and we'll go ahead and check them out. One of the things we're hearing is people say, I'm fully vaccinated. And when we check, they're not. So people can tell you anything. So unless you really saw their cards, or it was this one specific group that had a lot of breakthrough infections, that is not what we have seen. So Casey says, do we believe the Delta is the primary contributor to the current spike? Yes. And the reason we think that is that many other things haven't changed. Right? It's been a bunch of weeks since we've been getting around and visiting people. It has, the weather certainly is warm, so we don't think we can say it's the change in the weather. But we do know that it's the Delta. So again, we have had 2 known introductions and 3 other likely introductions in the last 4 weeks. And this is exactly what we predicted would happen when Delta got here, is it would spread like, we would say wildfire, but people are sensitive to that. So does getting vaccinated give you a positive test, even though you don't have it? No. So there are a bunch of different tests out there. So the PCR test and the antigen test, which are tests for the disease, do not turn positive if you get vaccinated. They don't turn positive if you get vaccinated. Both of those look for the N protein. The N protein is not in the vaccine, so there's no way you could get vaccinated. And the one test that does give you a positive test for is an antibody test. So antibodies are the things that are used to fight infection. And yes, getting vaccinated gives you a positive antibody test. So I donate blood, and every time you donate blood, they go ahead and check your antibodies. And since I've gotten the vaccine, my antibody test, yes, is positive, but the antigen test, if I'd done them, would be negative. So somebody says, can we go back to Facebook Live twice a week? Maybe, we'll see. We'll see. There's a lot of people involved in doing lots of things, so we'll see. There's a question about the test positivity rate for Lane County. We were 7% last week. I've not looked at it this week, but we don't get it day by day, so it's a little hard to know. So Kat says, can I estimate the percent of Douglas County folks who are long haulers? So when we have asked people who've had the disease, it depends upon when you ask them. So if you ask people 2 or 3 months after the disease, a majority of the people are still not feeling back to normal. By 6 to 8 months, more are feeling back to normal. And by a year, about 90% are feeling pretty much back to normal. So it depends upon how long out you are. So you could do the numbers and figure it out. So Nael says, St. Charles is canceling elective surgery. Oof. Will Mercy follow? I do not know. I talked to the people at Mercy yesterday. Mercy's struggling a little bit. As I said, they've got a bunch of people in their ICUs and their PCUs, but their biggest problem is actually not physical beds, but it's the trained personnel to take care of people in the ICU and the PCU, and the respiratory therapists, because most of these people have a profound respiratory illness. If you're on a ventilator, there's a lot of work the respiratory therapists have to do, keep that ventilator working perfectly. People on oxygen need a lot of work to go ahead and get their oxygen levels correctly. So the hospital is struggling with that. Although they're clearly at this point staying heads above water. However, had a call with the people from Jackson County last week. They had 85 people in their ED awaiting a bed placement because they were that filled up. And they were filled up for a couple of reasons. One is there were a lot of sick people there, but then there were a lot of people who needed to get discharged and there was no place to send them because the nursing homes were filled. And so there's a problem all along that system here and doing it. So hospitals in Oregon, when they added 50 new patients today, in one day, they added 50 new COVID patients. That is going to strain the hospitals. Hospitals in Oregon don't have a tremendous amount of excess capacity where people are sort of waiting around for something to do. Hospitals are really work pretty much at capacity on a regular basis. So if they have 100 staff beds, they typically are in between 80 and 100. So it's not like they have that much extra capacity that they can just bring on in a minute. And again, the problem is not beds or even really equipment. It's trained people to go ahead and do that. So what percentage of Douglas County is fully vaccinated? So this is complicated because the numerators and denominators change. So I'm going to give you two numbers. So if you look at the number of adults who are fully vaccinated, it's 42% according to the CDC. If you look at the number of people 16 and above who've gotten one dose of vaccine, that number is 56%. Still really low. All of those numbers are really, really, really low. I mean, they're really low. There's no reason we couldn't be at 80 or more percent that number. So if you look for the CDC fully vaccinated, it's 42. However, the CDC fully vaccinated misses a bunch of people. And then if you look at the our calculation of the one vaccine at 56%, that probably is the most accurate in capturing everybody. But that number, that number nationally is a little over 70% and clearly should be way over 56%. So we worry about that. All right, so let's see what other questions we have here. I may have answered this already, but do I have a number of fully vaccinated people who've gotten COVID regardless of vaccine? The answer was 19 in the last 2 weeks. And the next question is the J&J vaccine isn't as effective against the Delta variant, and that does seem to be true. Now remember, these vaccines were developed at a time before we even knew that a Delta variant existed, and so now the virus, especially the S protein, looks different than it did previously. So not shocking that the vaccine would be less effective. And the J&J was always the least effective of the three vaccines, and it appears to be probably the least effective of the vaccines against the Delta variant. I would not be surprised if the FDA would allow people who got the J&J to get one Moderna or one Pfizer. And again, it seems like the FDA has been on vacation this whole summer. They really need to help us with that guidance. I mean, there's no way I can specifically know whether we got the J&J should get the Moderna or the Pfizer or both, or one or the other, or a second J&J. And so this is where we really, really need the guidance of the people who are doing it. So of the 19 breakthrough cases, how many were J&J? Give me a minute here and I'll look. So we look at these every day, and then we're going through these things. Our team meets every weekday morning, and then on the weekends we look at this on ourselves. So when we look here on the breakthroughs, we had let's see, so you'll have to do this in your head here. One Pfizer, one Moderna, one J&J, another Pfizer, a J&J, a Pfizer, a J&J, a J&J, a J&J, a J&J, a Pfizer, a J&J, a J&J, a J&J, a Pfizer, a Moderna, a J&J, a Moderna, and a Moderna. So that is, J&J is a little overrepresented in terms of the number of vaccines we've given. In the community, we've given the most Moderna. They've had the most breakthroughs. We've given the second most Pfizer. They had the fewest breakthroughs. And we've given the least J&J. And again, they've had 1, 2, 3, 4, 5, 6, 7, 9, 10. So they've had 10 of the 19. And of the 19 were those hospitalizations, they were just positive cases. The only hospitalization we had that was a breakthrough was a J&J breakthrough. So again, it is seeming that the J&J is less effective against the Delta variant. Previously, before the Delta variant was here, the breakthroughs were pretty evenly distributed by amount of doses that we given. So it really does appear that the J&J may be less effective against the Delta. And that's why it would be really, really, really nice to know if we could get a booster to them. I mean, we have plenty of vaccine. The problem is not plenty of it. The problem is not vaccine. All right, let's see what other questions we have. All right. So given the new CD masking guidelines and the spike in cases, do we recommend vaccinated people wear masks indoors? Yeah. If I was going to be in a big group indoors, like I needed to go to a meeting where there are a bunch of people there, I would certainly wear a mask. If I needed to be at a doctor's office, I would certainly wear a mask. If I needed to go to a place where there are a lot of people, I would wear a mask. Now, I've been out this week and we've been to stores and restaurants and whatever. I think in places where I'm able to keep distance from people, I've not been wearing a mask. But in places where you either can't get an adequate distance or when there are a lot of people, I would wear a mask. All right, well, that looks like it for the night. We'll give another minute or two to see if people have other questions for us. But again, for people who may have joined us later, a huge increase in cases in Oregon, and especially a huge case here in Douglas County. So over the last 2 days, we've had our 2 worst days ever. Vanessa says we've had 89 new cases since yesterday at noon, and 22 in the hospital right now. And of those 22 in the hospital, some are quite young and quite sick. And this idea, well, they would have been there anywhere for something else, is so not true. It's just shocking. Just shocking how many people are there. All right, so I think we gave the vaccinated and unvaccinated numbers. Yeah, so we'll know about these 89 that come into the numbers that come in this week. We'll need to know about the vaccinated and unvaccinated. But overwhelmingly, the people who are really sick are unvaccinated. And so when I look at the hospitals today, here's the years of birth. One in 99. 99, all right? This person's 21 or 22 years old, and they're on lots of oxygen. More oxygen, 7 liters of oxygen. If you've ever worked in the hospital, most people on a liter or 2. 7 liters of oxygen for a 21-year-old is amazing. Another person on a ventilator, born in the 70s. Another person born in the 90s on a ventilator. And so these are young people who are so very sick. So 1, 2, 3, 4, 5, 6. 6 in the ICU. You realize there are only 16 beds total in the ICU, and then another bunch in the PCU. And so this is, if this continues, is really going to strain. So the question is, what's happening and how long is it going to last? So those of you who've been listening for a while, we really worried about the UK. The reason we worried about the UK is they had a alpha or B117 spike in December and January. Had really a lot of cases. Then came down in February, March, and by April they were really quite low. Then starting in April, the beginning of May, they then got the Delta variant. And when they got the Delta variant, they had a lot of cases. Up to 50 or 60 cases per 100,000 per day. Now, not as many deaths because many of the older people were vaccinated, and not as many hospitalizations, but still lots and lots of cases. And it continued then until really just this week, where the number of cases is now down to about 50 per 100,000 per day. So really 8 horrific weeks. And the concern is that we could similarly have these 8 horrific weeks until we get there. All right, let's see if there are more questions. All right. So get those last questions in here, and I'll give you the last look up my nose here. We'll have to work on the camera angle next time. So, question: tell us about the Lambda variant. So um, the Lambda variant is an interesting one. The Lambda variant is an offshoot, we think, of the Gamma variant. So the Gamma variant started in Brazil, and that's been a worrisome one because it's caused lots of disease in South America for a very long time, and it's caused a lot of disease for a very long time. And there were a lot of deaths in that area. Now that's the one area of the world that doesn't have a lot of Delta, but now it appears that the P1 has now moved into another variant called the Lambda, and we don't know that much about it. There are not enough cases of it, so we don't know. But typically, the variants we worry about are the variants that displace others, and right now, nothing is displacing the Delta. Delta appears to be the fastest of all of them. Stacy says, "Will the state go back to closures?" I don't know. I mean, I don't know politically what the state is going to do. I really get the sense that at this point, the state is not going to go back to closures unless something really tremendously different happens. So Kathy says, have I tried ivermectin? No, I've not tried ivermectin. So ivermectin is an anti-parasitic drug. It's a drug that's been around for a long time. Your dog is likely taking it for heartworm, and animals take it. And we use it in humans for different kinds of infections. There are some people who believe that ivermectin is a miracle drug for COVID, and this has taken a lot of oxygen out of the room. While people swear that it's a magic drug, and if we just used it, we wouldn't have to worry about vaccine or anything else. The problem is there's no good studies. There are a lot of little hints that ivermectin may work. So doctors who use it say, boy, it really works and it's great. But then when people have done fairly well-controlled studies, it doesn't seem to help. And if indeed it was such a magic pill, it shouldn't be hard to show. So you remember the one thing that we have for COVID that really does seem to work are the steroids. And it only took about 6 weeks for multiple studies to come out that showed that it worked. So the fact that we've been talking about ivermectin now for over a year and there's still no good studies makes me worry whether or not it works. I know a few people who've taken ivermectin, and again, most people who get the disease don't get seriously ill, so you'd really need to do a controlled study to see if ivermectin worked. It's hard to believe it's a miracle drug, right? It's hard to believe anything that's a miracle you could hide so well. So questions about school. What's the protocols for school? So again, I think the state has pretty much decided that it's going to be up to the local elected school boards to go ahead and make decisions for schools. There are clear recommendations for schools, clear suggestions about what they should do and how they would do it. But I think we're going to leave it up to the schools to decide. I think schools are likely to be open in person. I think there's going to be a strong push for schools to be open in person. Whether or not they're going to use masks, I don't know. And we'll see. Okay, so Kathy then also writes, please look again at the studies. There are over 50 proven studies. I would challenge you, Kathy. Give me the one study that you do. So everybody who talks about this tells me about 50 studies, and I've looked at these 50 studies again and again, and all 50 are crap. They're crap studies. You know, the only way to do a real study is to do it. So my challenge to you, Kathy, is give me the one study published in a reputable journal that I can believe in. I've asked 10 people this question. They all say, no, there's 50 of them. I can't give you the one there's 50. They're crap. Give me the one good one, and I'll be happy to look at it. So Joe says, has the FDA approved any COVID vaccines? Yes. So they've approved all of the COVID vaccines. They're approved under an emergency use authorization. So what happens for most drugs and things is there's no emergency, right? So there's a new drug out to treat toe fungus or a new drug out to treat arthritis. There's no emergency. And so what the FDA says is we're not going to approve this until You do a bunch of studies, typically take years to get done, do some safety studies, do some randomized controlled trials, and have 6 months, at least 6 months of data in your studies before we will give you full approval. The COVID vaccines were first tried on people in the fall of this year and then approved in December. Clearly, they didn't have 6 months worth of data at the time. They only had a few months of data, and there was an emergency, the COVID thing, and that's why they gave it the emergency use authorization. Drugs that are approved under the emergency use authorization are approved during the time of emergency, and the expectation is that they're going to gather the rest of the data and then get fully approved. So they've gathered that data. Pfizer and Moderna have submitted to the FDA for full approval. Full approval is a slowish process. The emergency use authorization was a relatively quick process, took just a few weeks. The full approval process is a long process, and my understanding is that the full approval for Moderna and Pfizer are on track, and they're getting there, and they will get full approval. So Kat says, is remdesivir available here? Yes, the hospital has remdesivir for people who are hospitalized, which is the current authorization. I wish remdesivir was better. So remdesivir is an antiviral drug which was developed first to treat Ebola, and they found that it was perhaps mildly effective against COVID. It is certainly not a silver bullet. It really is not a silver bullet. So Susan says, parents, regardless of what your local school board decides, ask your children to mask up, especially if they are under 12. Yeah, so we looked carefully at the school outbreaks. We have a really talented team of epidemiologists, and we asked them to look at the school outbreaks. And very clearly, the number one thing that you could do was to have the adults vaccinated, because in so many of these cases, there was an adult who was not vaccinated, and they gave it to their kids, and that's how it got into the school, or an unvaccinated adult who worked at the school and then brought it into school. So far and away, the most important thing was to get people vaccinated. The next most important things are the other measures: distancing, hand washing, wearing masks. And it's difficult to separate out all of them. Well, there was an interesting study from North Carolina that suggested that they looked at all the cases there. In cases where there was good, and schools in which there was good use of mask and distancing, had no spread among, or very little spread among kids. And in places that did not use masks well and didn't distance well, did have more cases. So their suggestion was that masking and distancing really does work in schools. Sarah says, you mentioned steroids being a useful treatment. So steroids, the one they're using is Decadron. So Decadron is kind of steroid. It's been around for a very long time, actually. I think since I'm in medical school, which is a long time, which is the last millennium. And it's a very potent steroid. We use it for a lot of things. In pediatrics, we use a lot for croup. So you remember the babies had that croupy cough, and Decadron is very effective for reducing the inflammation that leads to the croup. So steroids are really reduces the inflammation in the lungs, and by reducing the inflammation in the lungs, seems to really improve outcomes for people with COVID. So Veronica says, would I feel safe flying for 5 hours if you're vaccinated? I think last week I would say probably. This week is really dangerous. This is a dangerous week with as many new cases we've seen. Yeah. So somebody writes, one of the biggest apprehensions I've heard from young women is potential issues with fertility. Totally hear you. When I talk to young women, I do a lot, their number one issue is fertility. And this got started with no date at all. So it's not, sometimes things get started because something happens and you put it together and it may or may not be true. So for example, the deal with ivermectin is that some people used ivermectin and they thought their people had better outcomes than what other people are reporting. But that goes for so many other things. That goes for so homeopathic and other kinds of treatments for this. However, this with fertility it seems to be totally made up. I mean, there is no data at all that this should affect fertility. There's no clinical studies. There's no decrease in fertility from people who are in the original studies. There's no other vaccines that affect fertility. So it really came out of nowhere. But the problem with fertility is it's something we treasure the most. I mean, if you ask me what I treasure the most, it's my family. And if I was a young person, my family comes by me being fertile so that I can go ahead and produce more kids. So I can easily see why people are really worried about this. But there is nothing I can find behind this. I mean, I'm trying to find any shred of evidence that this is important, that this is real, and I cannot find anything to suggest this is real. And the other question is about boosters. So we'll talk about boosters one more time. So you do boosters for a couple of reasons. One of the reasons you would do a booster is that your immunity might wane. Second reason you might do boosters is because the disease has changed and you need to change the shot to deal with the new variant. So that's what happens with flu every year. The reason you need a flu shot every year is that the flu bug that's circulating is different all the time. And so at some point you may need a booster for COVID because of the new variants, but nobody has one even close to having a booster that's specifically against either the alpha, beta, gamma, or delta booster. And then you might need a booster because there's something totally new or different. So, for example, the Shingrix is out, and they're recommending people who got the old Zostavax now get a Shingrix. The Shingrix is a new and much better vaccine. Are we going to need boosters? We don't know. There's so much speculation out there. Maybe that people got the J&J will get boosters because the J&J does seem to be a little less effective against the Delta variant. We may suggest boosters for people who've had solid organ transplants because we know that people with solid organ transplants don't make a particularly good immune response and do make a better response if they get 3 doses rather than 2. And we might do it for older people because older people in general tend to make less good immune responses than young people. But right now, the recommendation is nobody needs boosters, but I'm really hoping that the FDA gets over their summer vacation. I don't know if they're taking a summer vacation, but they've been incredibly quiet over the last few weeks and help us with this. Because I don't know the answer, right? I can't in Douglas County or anywhere figure out what the right answer is until people have done the studies that show that boosters work, that they're safe and effective. And until people do those studies, we really can't tell. As I say, there has been a study in solid organ transplants, people who had kidney transplants, and it did seem to be safe and effective. So that might get approved. But for the general population, I don't know. Or for people who got J&J, I don't know. So, let's see if somebody could do Rebecca's question here. So the question about natural immunity. So the story is, if you do get infected with the disease, you do have some immunity. It's not as good as the vaccine. And it's really not as good as the vaccine. I think multiple studies have shown that the rate of reinfection is higher than with the vaccine, and the antibodies are not in high levels as they are with the vaccine. So natural infection is certainly better than nothing, but natural infection is a difficult way to go, right? So natural infection puts you at the risk of getting severe disease, and as people have said, there are a bunch of young, really sick people who are getting COVID and thinking, well, I'll just get right over this, and they really don't. The question about whether the people in the hospital have underlying conditions, they're just like the rest of us. I mean, a lot of us are overweight. Some of us have high blood pressure. Some of us have diabetes. Some of us have mental health issues. The people who were hospitalized, when we looked at their medical records, these are not people at death's door who just happen to get sick. They look like the rest of us. And so I don't think you can say, boy, I'm otherwise young and healthy. I have nothing to worry about. All right, let's see if I can do this. Okay. So I heard a VA nurse that patients that are coming are testing positive with COVID even though they have been vaccinated. And that does happen sometimes. But again, remember, 19 out of 224. So less than 10% of the time are the people who have been vaccinated. I mean, we hear a lot of anecdotally, oh yeah, I was vaccinated. And when you say, well, where were you vaccinated? And do you have your vaccine card? I don't have the card and I can't remember where I was vaccinated. So people, I'm not sure if people are always being truthful for this. We do know exactly everybody who's been vaccinated, everybody's been there. And there are some breakthroughs, and there will be breakthroughs with the Delta. Remember, the Delta variant has all of these mutations that make the spike protein look a little different, and your body's ability to respond is a little less. It's still really good. It's still probably 80% for disease and 95% for getting seriously ill. What we want to do is get enough people vaccinated so that those numbers are small. And again, in hospitalizations, we've only had one recent hospitalization among somebody who was vaccinated, and that was somebody who got a J&J. And so, again, to have 21 of 22 in that situation really suggests that the vaccine works, and it's really our best way out of it. So last question here. There was a deal about O blood type being more immune. Yeah, there are slight differences in immunity with different blood types and with other kind of things. Actually, the one that's the strongest predictor is the ability to taste bitter. So people who are able to taste it bitter seem to actually have a better time of it with COVID. Certain blood types seem to have a better or worse time with it. But the differences are small. The differences are only, a few percent one way or another. And since there's not much you can do about your blood type, it's not something we worry about. The one thing that is the biggest difference is vaccinated versus unvaccinated. And that is something you do have control over. Has the origin of the surge been identified? So we don't think there's one origin. Actually, we think this surge is is at least two, but probably five or even more separate introductions of the Delta variant from out of state. So one we know of from Arkansas, one we know of from Alaska, and we worry about ones from California and Arizona. So again, there's no way this is a country where people move and move it and bring things in. So Rebecca says, I had COVID. I was sick as a dog for 2 weeks. I'm sorry to hear that. I have had my antibodies tested. They were high. I have no reason to vaccinate. Look, we're not making anybody get vaccinated. If you were sick as a dog for 2 weeks, I'm really sorry to hear that. And you probably have some antibodies. And if you're relatively young, you have about 80% protection. And so if you individually don't want to get vaccinated, that clearly is a choice. But we only think that about 5,000 people in Douglas County have had the disease. That means there's 107,000 other people out there who really should get vaccinated. All right, a nice comment from Joe. We'll call that a night. It's after 7 o'clock. We'll see how things are going. If things are still really busy on Friday, we may do this again.